Hi, I'm Amanda Olson from IntimateRose.com, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And today we're going to talk about pelvic floor muscle release. And when we're talking about release of any muscle, what we're actually describing is restoring it to its normal length. So oftentimes what can happen is the muscles of the pelvic floor can become too tight or too loose in some instances, but today, describing release, we're going to talk about pelvic floor muscles that are too tight for one reason or another. This can happen after having surgery. It can happen after injury, like falling down on your bottom or onto your tailbone, or other types of accidents around the hip and abdominal and trunk region. It can also happen just because of kind of a subconscious clenching of the muscles. So similar to people that you think about that under stressful circumstances, or maybe there's a lot of work, they kind of bring their shoulders up towards their ears and they end up with neck pain and headaches and those kinds of things. People can do that in the pelvis. Both men and women can unconsciously be clenching them throughout the day during times of stress, or maybe fear, or maybe it's just their regular holding pattern. So when we're talking about release of the pelvic floor muscles, we're talking about a multifaceted approach to learning to relax the pelvic floor muscles, drop them, and then restore the length. And so I just want to do a brief overview of anatomy of the pelvic floor. This is a female model, but keeping in mind that men can have too tight pelvic floor muscles as well. And there are some similarities in the anatomy. So here is the front of the pelvis and the back here. You'll see the spine coming up. And this is a top view of the organs. You'll see the bladder in the front, the uterus and the vagina in the middle, and then the rectum in the back. I'm going to take these organs out and show you here. Everything that you see in red is musculature. So starting at the pubic bone, forming a bit of a diamond coming wide to the ischial tuberosities, or the sit bones, and then swinging back down to the tailbone. It encircles the urethra, the vagina, and the rectum. And in men, very similar, of course, no vagina, so two holes, one in the front, one in the back, but the superficial layer of pelvic floor muscles here. Deep to that, another layer of pelvic floor muscles. You'll see they come all the way to the front of the pubic bone. They swing wide, they come back to the tailbone. There are several different muscles in here, but we collectively call this the deeper layer of the pelvic floor. And they do share a fascial connection with the superficial layer. So when we're talking about learning to relax the pelvic floor muscles, it's important to acknowledge the role of breathing in the tone of the pelvic floor and the ability to contract and relax it. So if you think about what you saw here, you think about the pelvic floor muscles, and they're too tight, so they're a little bit elevated and a little bit closed, or maybe a lot of bit elevated and a lot of bit closed. So they're up here. The natural forces of the relationship between the diaphragm, the muscle that we breathe from up here, up high in the trunk and the pelvic floor, is similar to a piston. So when we inhale, the diaphragm drops down, and so does the pelvic floor. And when we exhale, it lifts back up to press that air out. So when you are first learning how to relax the pelvic floor, it's really helpful to lay down in a quiet place and really focus on what you feel in your body when you inhale. So when you inhale, you're looking for a very slight drop. It is very, very slight. There's not going to be a lot of earth-shattering things here unless you take a big breath in and actually bear down into the pelvic floor. So you're just going to feel that drop happen, and then normal breath in, normal breath out, feeling for that. You can work into that inhale drop a little bit by performing a little bit of a bulge. So when we're talking about releasing the pelvic floor, we can do it using our own breath pattern and a little bit of force downward. And when I say a little bit, I mean very slight. So you could almost just imagine maybe a flower blooming down and out very slowly and very gently, and then coming back up. one thing that you can do is place one hand kind of broadly here on the perineum and over the genitals and feel it come into your hand as you're going through that exercise. So on the inhale, you're going to feel that pressure come down into your hand, and on the exhale, lift. Using your hand is one way of your brain being able to recognize what's happening. So the hand brings the attention to that area of the pelvic floor, and you can feel that drop and lift happening. Another way to perform release of the pelvic floor muscles is to use a massage technique or trigger point release technique. Trigger points being little areas of knots that form in the pelvic floor muscles. So the same way that you might get a knot in your shoulder or in your neck, you can get them in your pelvic floor muscles, especially after chronic clenching patterns, sometimes months, sometimes years. So here, the Intimate Rose vibrating pelvic wand that I designed allows you to use either end in either the vagina or the rectum to be able to reach in and either perform a gentle sweep and massage technique onto the pelvic floor here, or to turn it on, and that vibration sensation, we have 10 different settings on the vibrating wand. The vibration is going to bring blood flow into the area, just as the general mechanical nature of vibration, and it's also going to help the pelvic floor muscles to be able to relax. So with that, you can, pretending this is the vagina or the rectum, insert here and come along and gently sweep through on the top part, sweeping through along the bottom and into the side walls of the pelvic floor. And this particular tip is really great for reaching obturator internus, which is a muscle that lives on the very side of the pelvis. I specifically designed this hook angle to be able to come through and get into that far side of the pelvic floor here to be able to release trigger points there. So when you're sweeping through and you locate a trigger point, what you want to do is you want to hold a pressure on the trigger point similar to how you would check a tomato. So for example, if you're checking a tomato for ripeness, you would gently compress it, but you would not squish it lest you destroy your tomato. The same thing is true for the pelvic floor muscles. We don't want to push too hard, we don't want to be too gentle, but it's just the same pressure that you would use to check a tomato. So if this is the pelvic floor and I've located a knot here in my pelvic floor muscle, I'm holding the wand through the vagina or through the rectum, you're going to hold that position there with that tomato touch, and you're going to hold it for about a minute or two. What will happen is the knot will start to shut down. It may start to quiver a little bit, and that's totally normal, but after 1 to 2 minutes, it's going to shut down. One thing that you can do while you're maintaining that pressure, you found a trigger point that's tender. If you're laying down with your knees bent and your feet planted, you can move your knee in and out until you find a location where the pain goes away. You want to maintain that position for a minute or two while you're simultaneously compressing. So your hand is here compressing the trigger point, and you've moved your knee in and found a position where the pain has gone away. Hold it for 1 or 2 minutes, bring your knee back up, and the trigger point should have let go. And that is kind of the release that we're talking about of a trigger point, is that knot stops contracting at the muscle. The knot doesn't stop contracting itself, but the muscle stops contracting in that tight form to release that knot, and that length is restored for the pelvic floor muscle. This should be done daily. So when you are in pain, whether it's new pelvic pain or long-standing chronic pelvic pain, being able to reset daily while you're learning not to clench those muscles and while you're doing other exercises to help restore your posture and your different movements throughout your day, so that you ensure that you're not getting that muscle to clench again. The breathing and the trigger point release should be done daily, even twice a day if you can. But all of these things come together to form this relearning of how to hold the muscles in a neutral state. Obviously, when we sneeze or cough, we want the muscles to contract. Contracting is not a bad thing. It's just that we need to have muscles that are able to contract and are also able to relax and drop back down. So daily breathing and relaxation techniques, stretches as well, and then use of trigger point release to help restore neutral pelvic floor muscle length is all going to be a very healing part of your process to eliminate pelvic pain. For more information, visit intimaterose.com.